I'm Amar, I'm Chief Quality Officer at East London Foundation Trust. And just a little introduction from me about why this is so important. Statistical process control forms part of our strategic approach to improvement. It goes hand in hand with applying a systematic method to solve our complex problems. And so this is why it's so important for us. When nearly 10 years ago now, when we had a number of sentinel events, we needed to find a different approach to shift the power closer to our front lines, to give people the tools they need to be able to understand quality and safety and be able to improve it, using the ideas that come directly from their patients and their staff at the front line. So we began to start conversations with our board about what would it mean for us to apply a systematic approach to quality improvement across the organisation. One of the first things we did was to change the board reporting. I took an 80-page report that was full of quarterly data in tables and turned some of the key data in there into run charts. Really simple data over time, just using a median to help us start to understand variation. And automatically that led to a much richer conversation at the board. It was clearer now which things we didn't need to pay attention to because they were largely in control, and which things we did need to pay attention to. And that was the beginnings of this journey. Obviously, when you apply quality improvement at scale, as we've been doing now for 6 to 7 years at Delft, part of that approach is about measurement. So we have 350 teams, all of whom now are measuring in a very different way than they used to, with the measurement being owned much closer to the point of care. I wish we could have done this sort of thing 8 years ago. And that's really why this sort of tool could have such a big impact, because it draws on the data we already have in our systems and allows teams to see it very quickly to help understand variation. So we teach people at Delft how to create control charts and how to interpret them to make better decisions, because I think that's what it does. Being able to view data over time using control charts. So what we've developed here is a range of control charts to give people the opportunity to use the most appropriate chart for the type of data they're using. It's a question about what's going to help us make better decisions and using the most appropriate chart for the type of data. That's why I think it's really important that we have the range of control charts that we're making available here so that you can choose the most appropriate one.